What happens if your surgical drain isn't drained properly? Imagine waking up after surgery, feeling hopeful about your recovery. You might not realize that a small tube, called a surgical drain, plays a big role in your healing. But what if that drain isn't working as it should? Let's break down what can happen if your surgical drain isn't drained properly. First, fluid accumulation can occur. When the drain does not remove excess fluid, it can collect around the surgical site. This can lead to a hematoma, which is a collection of blood, or a seroma, which is a collection of fluid. Both conditions can cause swelling, increased pain, and discomfort. Next, there is an increased risk of infection. When fluid builds up, it creates a perfect environment for bacteria to grow. Signs of infection include redness, warmth, swelling, foul drainage, and increased pain. If you notice any of these symptoms, it is important to contact your healthcare provider right away. Another issue is drain blockage or malfunction. If the drain tubing becomes kinked, clogged with blood clots or debris, or disconnected, it will not work properly. You might notice that the drain bulb does not stay compressed or fluid is leaking around the drain site. This indicates that fluid is trapped in the wound, which can lead to further complications. Skin irritation and leakage are also common problems. Fluid leaking around the drain site can irritate the skin, causing redness and tenderness. If your dressing becomes wet or soiled, it should be changed promptly to reduce the risk of infection. In some cases, retained drain fragments can occur. If the drain is not removed properly or breaks during removal, a part of the drain may remain inside the body. This can lead to ongoing pain or a feeling of having a foreign object inside, which may require further surgery to address. To ensure proper drain care, it is essential to regularly empty the drain reservoir, usually at least twice a day. Keeping the drain bulb compressed helps maintain suction. You can also milk or strip the tubing to prevent clots from forming. Always keep the insertion site clean and covered with a sterile dressing. If you notice that the drain does not hold suction, leaks, or if the site becomes red and painful, notify your healthcare provider promptly. Following these steps helps prevent complications, promotes healing, and reduces the chance of needing additional procedures related to drain issues. Always follow your surgeon's specific instructions regarding drain care and removal timing.